Next one is Dan from startup Neuro Audit. Dan, are you ready? Check, maybe you are muted, so we don't hear you.
Yeah, now you can hear me.
Yeah, it's okay now.
Yeah.
Let's start.
Okay, so guys, thank you all. I'm very glad to participate here in Unicorn, Isia. We are Neuro Audit from Israel, and actually we developing a cognitive boost just when you need it. Few points about Neuro Audit. Neuro Audit founded in 2016, and we developed a very innovative psychoacoustic neuromodulation, we call it. And we use it for a personalized treatment of brain disease or brain disorders. Our unique product is a daily patch that delivery cognitive boost. And here, the innovative things behind that we are using for healthy people. The first stage is to use it with healthy people. Our challenges, we found that world's population actually use sugar, caffeine, energy drinks, sometimes drugs, just to get much higher cognitive performance. So this is our solution, a daily patch that you, at the end of the day, you can try it. And our business model is actually offline software license just for 8 hours, just for 8 hours. Our first market that we are speaking about, this is the college students from the US, because we know that the age of 19 to 29 mostly are healthy people, and the alternative side to energy drinks, caffeine, drugs, sometimes alcohol, etc., etc. Few points about our activity, main goals in 2020, we completed our POCs, test cases, and we completed prototype development. And of course, we send our provisional for patent. And as we watch on 2021, we are ready for go-to-market stage. Few points about our team. I'm the CEO and the business development, and Dr. Lionel Kriaf, MD advisory board, mostly work around Alzheimer's disease for many years and diagnostic with PET-CT. Alon Sinai clinical science that work in Rambam Hospital and work with focus ultrasound technology, and Boaz Sadeh, also neurophysiologist that works so many years with startup companies. Let's deep inside about a scientific side. We had so many test cases because we are working on the brain activity. So when you are working on brain activity, you need to ask small questions and get big answers. So since 2016, so many test cases, TDCS technology, ADHD side, sonic stimulation to the brain, EMG, and at last, ultrasound stimulation. We had wonderful test case in Japan with one Japanese company, Aston companies, that work around diagnostic, and we found some amazing results around our technology. More than 70% of cognitive performance was correlated with less brain activity. Less brain activity is relax the brain, the stimulation relax the brain and get much higher cognitive performance. Secondly,
but time is over.
So this is another test case, and about our activity. We had so many collaboration activities in Japan around our technology, and our timeline at the end start from now at wellness in the US and Japan, and our product roadmap for 9 months. First milestone, jump out to the market. I was Danazio. Many thanks.
Thank you so much. Thank you for great pitch, and it's time for questions.
Yes, can you please nail down the problem, like very shortly, that you are solving with your product?
Yeah, of course. We found world population use energy drinks, sugar, caffeine, sometimes alcohol, drugs like Ritalin and amphetamine, and this is the alternative side that we bring to the stage to use cognitive patch on the carotid and get much higher cognitive performance for healthy people. This is the first stage. Later on, our long term is to use it for brain disease and brain disorders. The first one is Alzheimer's disease, because when we speak about cognitive side, we can find cognitive problems of many brain disease and brain disorders.
Yes, please. Any other questions?
Can you explain what specifically the patch does to stimulate, and how does it regulate the proper amount for a particular individual?
Oh, great question. Actually, we can find so many brain technology that work as a wearable device, mostly on the skull. And I'm not sure if you all know that the big problem that we have around neurotech or neurostimulation, this is our bone, skull, actually. This is the big problem. So we use a patch, daily patch, that we put on the carotid, actually, and working via the blood, stimulate the brain via the blood, clean stimulate to the brain, and understand that our stimulate actually boosts the cognitive side.
Yeah, what exactly, can you be more specific about what specifically is responsible for the stimulation?
Of course, we can find technologies that work around electricity stimulation, electromagnetic stimulation. We work on very unique technology that's called ultrasound stimulation to the brain. Our big brother, mostly this is the focus ultrasound, big machine that stimulate the brain. And the innovative thing that we take a big technology and shrink it to a daily patch. Short ROI for the inventor, actually less brain activity and cognitive boost, of course, and short ROI for the investor, and less money for the customer, for the end customer.
How much do you charge for 8 hours use?
Oh, really good question, actually. Inside the 8 hours, the full stimulate is just 15 minutes, because you cannot stimulate the brain actually for 8 hours. This is something crazy to get. It's just 15 minutes. We speak about the daily patch that work just for 8 hours. Like a pill, actually, just for 8 hours. Inside the full stimulate to the brain is actually 15 minutes.
Thank
And
you.
how much do you charge for that?
I'm sorry, let's continue in chat because we need to follow our schedule.